We start with CSM. The death toll from the outbreak of cerebrospinal meningitis in the Upper West region has risen to 43 from the previous 40, with infections currently standing at 273. Government has deployed a team of top government health officials to the region to deal with the matter. Upper West Regional Minister Dr. Hafiz bin Salih has been briefing journalists in the region on the latest deaths. Rafiq Salam is our Upper West Region correspondent. He will join me shortly with more, but he's been speaking with the minister. Listen.
Upper West Regional Minister Dr. Hafiz bin Salih since last week has been meeting members of the various public health epidemic committees in the region to abreast himself with the issue of the cerebrospinal meningitis (CSM) and the COVID-19 pandemic. The Jirba municipality is one of the hardest areas hit by the CSM in the region, with a recorded death of 7 persons.
We had our first CSM case in January 9, 2020, and since then we have had 50 suspected cases. 16 were positive cases, and out of which 7 deaths.
On COVID-19, the municipality is yet to record a case, as they have employed several strategies to ensure that suspicious characters who enter the municipality are reported to the appropriate authorities.
Anybody coming in, everybody is too keen to identify cases, and so any stranger coming, we are notified because they have our hotlines. There are rumors everywhere that we do follow up to ensure that what they are saying is either true or not true, but just to allay the anxiety of people.
Upper West Regional Minister Dr. Hafiz bin Salih described the death of the 40 persons in the region through CSM as worrying and urged the people to seek early treatment, as treatment for the disease is free.
And the good news is that for the treatment of CSM, it is completely free. The medicine that is used for its management, they were donated to us free of charge. So we expect that when they are being administered, it should be free of charge.
The regional minister then moved to the Lora municipality, where he called on the paramount chief of the Lora traditional area, Napowele Kabu III. Napowele Kabu III, who initially was not comfortable with the number of deaths recorded on CSM in the region, was however hopeful that strategies put in place by the health authorities will yield the desired results.
In your monitoring, you should start educating us early before the temperatures begin to rise. We appreciate the fact that the virus is mutating and therefore creating problems about the medicine that we use to treat it. But if we go back to history, you will see that the chiefs played very key roles in getting the people to understand this. For a long time, we had thought that CSM has been kicked out of this place. But alas, it is not the case. But we are happy that the health people are putting in appropriate structures, and we as traditional authorities are there. And personally, I would like to cooperate with I will cooperate with my district health directorate to see that our people are educated to report the cases early enough so that it can be treated.
The minister climaxed his day at the Lora municipality with a meeting with members of the Lora Municipal Public Health Epidemic Committee. Reporting for JoyNews, Rafiq Salam, Jiroba.
Rafiq Salam joins me now via Zoom so we can have more on this rather worrying situation in the Upper West region. Hello, Rafiq.
Hello, Gifty.
Rafiq, let's start with government's delegation. What really is the composition of this delegation, and what are they supposed to do exactly?
This is the delegation led by Deputy Minister of Health, Dr. Oko Boy, who is in the region. Is also a sequel to other visits to the region by the director in charge of disease control and infectious disease last week. The Upper West Regional Minister met the overlord of the Walla area, now for seeing the people, the FOP, and also some members of the regional and municipal emergency management committees. And so basically, according to Dr. Okoboy, it's a visit that he wants to do a close review of how prepared are these emergency committees to fight the COVID-19 and cerebrospinal meningitis CSM.
Okay, Rafi, thank you for that. But how long are they supposed to stay in the region?
It's a 2-day official working visit to the Upper West region by Dr. Oko. And then as I speak to you now, he's currently about leaving Jiroba. After meeting with the regional minister, he met the one and also moved straight to Jiroba, who serves as the epicenter for this cerebrospinal meningitis. So he went there, met the municipal chief executive, Christian Bomanja Amadou, and then also after that, he met members of the municipal public health epidemic management committee, and also met staff of the Jiroba St. Joseph Hospital. And these nurses have been talking about some challenges that are facing in their fight against the COVID-19 pandemic and the CSM epidemic. And so basically the challenges have to do with their allowances and also some logistics to fight the COVID-19 and the CSM.
Have they had any responses from this government delegation, or in other words, what is the government delegation telling them?
Dr. Oko didn't mince words. He said government is really serious about not fighting only the COVID-19 pandemic, but they also are fighting CSM and also other infectious diseases. And so government has not put its eyes off the ball, and they are serious, much concerned about the CSM, because the people are in the region is unacceptable, and so they will do everything within their means to ensure that the lives of the people in the Upper West region are safe.
Rafiq, let's focus more on the people now, the people who are suffering from CSM at the moment. The minister had to reiterate that the treatment is free, because we know that health experts there have raised concerns about how late people report to the hospitals. Is it that people think that they have to pay for treatment, which is why they're going to the hospitals late? Why? Why was it even necessary for the minister to reiterate that it is free?
I think that all these things have to boil down to education. CSM usually occurs in this region between November and then April. I think that the education on the disease was also on the low side. They have not done a lot of education on the disease. And so even people went to bed, and we thought that CSM was even eradicated from the system until the whole region were caught flat-footed on that particular issue. And so, yes, I spoke to one person who was suspected to have disease, and they thought that at first because they didn't think that their case was even medical. And so people were not ready to go to these health facilities with under those conditions. And even when we were when we met Dr. Osekofo Afre, the Upper West Regional Director of Health Services, he said that, on the issue of COVID-19, they are asking people to stay at home. And so people have construed this stay at home with CSM. So people may have been having the disease, but they will be stay at home. So he's saying that people are really confused in the region when we talk about stay at home. Stay at home here means COVID-19, but as for CSM, you have to go to the nearest facilities, health facilities, for you to be treated. And so the minister also reiterating the point, yes, it's something that he's rehashing for the people to know that CSM is, when treated, is free.
If you live in this region, the Upper West region, I'd love to hear from you. Send us a message. Rafiq Salam is joining us from there, bringing us up to speed on the situation there with cerebrospinal meningitis, which has killed 43 people. Rafiq, I want to find out from you, if I understand what you're saying correctly, it looks like there's been lack of rigorous education about CSM. It looks like there are also spiritual, the fact that people who live there link this disease to spirituality rather than health has also added to the number of deaths and the number of infections we've recorded. And then there's lack of clarity in the messages between COVID-19 and CSM. If I understand you clearly, these are the main reasons why we're recording these. But Rafiq, I'm still with you. But this is not a disease. This disease is not new to the region. Is it only COVID-19 that's creating the confusion, or is there something really wrong that is not having the attention needed?
I will put it on the education side because, to be honest with you, there have been low education regarding CSM.
Okay.
You know, over the years, what usually happens is that people around November, December, people are encouraged not to sleep in poorly ventilated areas. People are encouraged to even sleep outside for their rooms because if we don't have funds. But I can tell you that the past 3-4 months, I haven't heard even any radio message or any public gathering this health practitioners talking about this key message that people need to sleep at places that are well ventilated. And then also the other issue, like I told you about, has to deal with this issue of the spirituality. And then you have people who think that this disease is not medical, but they think that it's also spiritual. And then lastly, like I told you, has to deal with the COVID-19 message, which means that stay at home if you have anything to do important outside. And so those people who are having the CSM, you know, CSM has similar symptoms like that of COVID-19,
okay.
You know. And so whatever that you do to get CSM, when you do that, you can get COVID-19. And so people misinterpret this information when they say stay at home, and then when they have the CSM, they stay at home and they're not going to facilities.
Rafiq, thank you for that update. Rafiq Salam is coming to us live from Wa via Zoom. Like I said, if you live in this area, I want to hear from you. What is your own story? What do you think will help deal with the rising infection rate of cerebrospinal meningitis in a region that has killed 43 people so far?